12 signs of separation anxiety disorder. Separation anxiety disorder is a real and serious mental health condition that can cause a great deal of distress and inconvenience in sufferers' lives. It's characterized by intense anxiety and fear in response to separation from loved ones or other figures of attachment. Obvious signs of separation anxiety disorder include intense worry about losing or not being able to find important people in one's life, distress at being away from home or loved ones, compulsive phone checking and text messaging to maintain contact, and avoiding activities or situations where separation may occur. SAD usually begins in childhood, but it can also develop in adults. It's generally treated with psychotherapy, medication, or a combination of both. In this video, we'll discuss the signs of separation anxiety disorder and how it can be treated. So watch till the end. And if you haven't liked the video yet, be sure to like it and subscribe to our channel so you don't miss any further videos. Here are some signs of separation anxiety disorder. Number 1. Excessive crying or tantrums. Mood swings and crying spells are common amongst toddlers and young children. However, if these behaviors persist into adulthood, they may be indicative of a more serious problem. Excessive crying or tantrums that occur in adulthood may be a sign of separation anxiety disorder. This condition is characterized by a fear of being away from loved ones, as well as an intense anxiety and distress when separated. If you or someone you know is experiencing these symptoms, it's important to seek professional help. With treatment, a separation anxiety disorder can be managed and the individual can learn to cope with their fears. Number 2. Difficulty sleeping. Most people experience some form of separation anxiety at some point in their lives. This is perfectly normal and usually goes away on its own. However, if you find that you're having difficulty sleeping or are constantly worrying about being away from loved ones, it could be a sign of separation anxiety disorder. This disorder is characterized by a fear of separation from attachment figures, such as parents or guardians. This fear can cause a variety of symptoms, including difficulty sleeping, nightmares, and night terrors. If you think you might have a separation anxiety disorder, it's important to talk to a doctor or mental health professional. They can help you understand what's going on and provide you with treatment options. With the right help, you can overcome this disorder and start sleeping peacefully again. Number 3. Nightmares about separation. Most people have occasional nightmares, but if you have nightmares about separation, it may be a sign of separation anxiety disorder. Separation anxiety disorder is a real condition that can cause serious distress. People with a separation anxiety disorder may have nightmares about separation, or they may be experiencing other symptoms such as trouble sleeping, sweating, or heart palpitations. If you have a separation anxiety disorder, you may feel like you can't be away from your loved ones for even a short period. If you think you may have separation anxiety disorder, it's important to see a mental health professional for evaluation. Treatment for separation anxiety disorder can be very effective and can help you learn to control your anxiety so you can live a full and healthy life. Number 4. Excessive worry about loved ones getting hurt or sick. It's only natural to worry about your loved ones from time to time, but if you find yourself excessively worrying about their safety or well-being, it may be a sign of separation anxiety disorder. Separation anxiety disorder is a type of anxiety disorder that's characterized by excessive worrying about the safety and the well-being of loved ones. This worry can be so severe that it leads to anxiety and distress. People with a separation anxiety disorder may also avoid leaving their loved ones alone, or they may experience physical symptoms such as shaking or sweating when they're apart. If you find yourself excessively worrying about your loved ones, it's important to talk to a doctor or a mental health professional. Number 5. Refusal to go to school or work. It's normal for young children to experience some anxiety when starting school or daycare. However, for some children, this anxiety can become so severe that they refuse to go to school or work. This is known as separation anxiety disorder. Separation anxiety disorder can have a significant impact on a child's life. It can interfere with their schooling as well as their social and emotional development. Children with a separation anxiety disorder may also have difficulty forming and maintaining friendships. If you think your child may have separation anxiety disorder, it's important to talk to your doctor. There are treatment options available that can help your child overcome their anxiety and lead to a normal, healthy life. Number 6. Constant clinginess. Separation anxiety disorder is a condition in which a person experiences intense anxiety and fear when separating from someone they're attached to. This can be a spouse, partner, parent, child, or other close relative or friend. The anxiety can be so severe that it interferes with the person's ability to function normally. If you or someone you know is experiencing constant clinginess, it may be a sign of a separation anxiety disorder. If you're worried about someone you love, it's important to reach out to a mental health professional for help. Number 7, panic attacks. Panic attacks are one of the most common symptoms of separation anxiety disorder. A panic attack is a sudden feeling of fear or discomfort that can include a racing heart, sweating, shortness of breath, and dizziness. Many people with a separation anxiety disorder also have agoraphobia, which is a fear of being in places where escape might be difficult. While panic attacks can be scary, they're not dangerous. If you or someone you know is having a panic attack, the best thing you can do is try to stay calm and breathe slowly and evenly. Some treatments can help people with separation anxiety disorder manage their panic attacks. If you're concerned about your symptoms, please talk to your doctor or a mental health professional. Number 8, difficulty eating. Eating is a crucial part of our daily routine. We need food to survive, and the act of eating is also a social activity that helps us bond with others. But for some people, the act of eating can be a source of anxiety. Difficulty eating is one of the hallmark signs of separation anxiety disorder, a condition that causes people to feel anxious and panicked when they're away from their loved ones. If you have a separation anxiety disorder, you may have trouble eating when you're away from your family or friends. You may also have difficulty sleeping. You may feel constantly on edge. If you're struggling to eat because of anxiety, it's important to seek help from a mental health professional. They can help you understand your anxiety and develop coping strategies to make mealtimes less stressful. Number 9, stomach aches. Separation anxiety disorder can affect people of all ages, and one of the most common signs of this disorder is stomach aches. If you or someone you know suffers from chronic stomach aches, it could be a sign of separation anxiety disorder. This disorder can cause a person to feel nauseous, have abdominal pain, and experience other gastrointestinal issues, all of which can be extremely debilitating. If you think you or someone you know may be suffering from a separation anxiety disorder, it's important to seek professional help. This disorder can be effectively treated with therapy, medication, or a combination of both. Number 10, headaches. Headaches are often associated with stress or anxiety. However, if you're experiencing frequent headaches, it could also be a sign of a more serious problem, separation anxiety disorder. Separation anxiety disorder is a condition characterized by anxiety or fear when separating from loved ones. This can often manifest as physical symptoms like headaches, stomach aches, sweating, and difficulty breathing. If you're experiencing any of these symptoms, it's important to see a doctor to rule out any other potential causes. Separation anxiety disorder is a serious condition that can be difficult to cope with. However, with the help of a mental health professional, it's possible to manage the symptoms and live a normal, healthy life. Number 11, persistent homesickness. Homesickness is a common feeling that most people experience at some point in their lives. Whether it's due to a temporary separation from home or a longer-term move, homesickness is normal and usually goes away on its own. However, in some cases, homesickness can be a sign of a more serious problem called separation anxiety disorder. Separation anxiety disorder is a type of anxiety disorder that can cause people to feel extremely upset when they're away from home or separated from loved ones. People with separation anxiety disorder may also have physical symptoms like nausea, headaches, and difficulty sleeping. If you or someone you know is experiencing these symptoms, it's important to see a doctor or a mental health professional for help. Number 12, excessive fear of abandonment. Separation anxiety disorder is a condition characterized by excessive fear of abandonment. This may be due to real or perceived separation from a loved one. The fear can lead to physical and psychological symptoms, such as dizziness, shaking, and difficulty breathing. If you think you may have a separation anxiety disorder, it's important to seek professional help. A mental health professional can help you understand your symptoms and develop a treatment plan. With proper treatment, you can learn to manage your fear and live a healthy, happy life. Now we will discuss how separation anxiety disorder can be treated. There are several ways to treat separation anxiety disorder, a condition that can cause significant distress and interfere with daily life. While there's no single cure for separation anxiety disorder, there's a variety of effective treatment options available. Treatment for a separation anxiety disorder often includes a combination of medication and psychotherapy. Medication can help to reduce anxiety symptoms, while psychotherapy can provide long-term relief by helping patients to understand and manage their anxiety. Treatment options include therapy, medication, and lifestyle changes. One type of therapy that may be used to treat separation anxiety disorder is cognitive behavioral therapy, or CBT. This type of therapy can help an individual to identify and change unhealthy patterns of thinking and behavior. Medication may also be prescribed in some cases, and lifestyle changes such as increasing social and recreational activities may also be recommended. The most important thing is to get started on treatment as soon as possible. Separation anxiety disorder can be a debilitating condition, but with proper treatment, most people can learn to manage their anxiety and live normal, productive lives. If you or someone you know experiences several of the symptoms on this list for an extended period, it may be indicative of a separation anxiety disorder. Separation anxiety disorder is a treatable condition, so if you believe you may be suffering from it, please reach out to a mental health professional for help. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos, and share your thoughts on this in the comment section below. Thanks for watching.